All right, we'll begin. Hello, everyone, and welcome to the third lecture in this quarter's Food System Seminar Series, Growing Resilience and Equity. My name, as you know, is Yona Sipos, and I'm very happy to be back here with all of you. I hope you are all taking care as best as possible. And as with last week, before I get to introduce our renowned speaker for today, I'll begin with just a few announcements. So beginning with our land acknowledgement, as you all know, it was Indigenous Peoples Day this past week. And here in Seattle, we are of course on traditional Coast Salish territory, including the lands and waterways, specifically of the Duwamish, Muckleshoot, Tulalip, and other Coast Salish tribes and nations who are still here. Indigenous Peoples Day, as a reminder, was last Monday, October 12th, and it's a holiday that celebrates and honors Native American peoples and commemorates their histories and cultures and present. I also mentioned last week that we were just coming up on World Food Day, and by the time you'll review this seminar, it will have passed, as it's on Friday, October 16th. But we are recording on Friday, October 16th, so I thought it was worth another mention. The theme for World Food Day is Grow, Nourish, Sustain Together. And I've seen various voices online chiming in with encouraging feedback that this is a hopeful and inspiring theme for our time, especially amidst the major challenges that we are facing. Malnutrition of all forms, food waste, climate change, and of course, the global pandemic. World Food Day, as you'll see here, is calling for global solidarity at this time, particularly to support the world's most vulnerable people in order to recover and make food systems more resilient and equitable in the short, medium, and long term. So this is a great lead-in to today's speaker. And just before I turn it over to him, I'll remind you that we saw this graph on the first day. And it's a graph that demonstrates that food security is a common metric of food system resilience, or rather to assess food system resilience. And as a reminder, again, we defined food security on the first day, and we'll hear much more about it for today, but we've also posted an optional reading for this week, which is introducing basic concepts of food security. This is an international concept that has been refined over time, and it continues to be extremely relevant globally and within our context of Washington State, which is what we'll be focusing on today. As one final reminder, we will have another reflection due this Thursday, and this is just for the Nutrition 400 students. Two main questions to address: what did you learn, and what questions remain for you? And a reminder to include a reference to at least one of the required readings that are posted under the modules for this week. Any consistent format is fine for referencing, and you can see that we've included here and within the modules a link to the UW Library Guide on proper citations. So please review that and make sure to include a reference within your reflection. So with that, I get to introduce the guest speaker for today. It's my great pleasure to introduce you all to Dr. Adam Drewnowski. Dr. Drewnowski is the director of the Nutritional Sciences Program and the Center for Public Health Nutrition. His full bio is posted on Canvas. And today he is here to discuss the impact of COVID-19 on food systems, food security, and food access in Washington State. So with that, I'm going to stop sharing and invite Adam to start sharing, and I will turn it over to him. Thank you so much for joining us, Adam. We're really excited to hear from you.
Thank you, Yona. My presentation today has to do with economic security and food access in Washington State during the COVID pandemic. Economic security and food access are, of course, determinants of food security. So we will talk about food insecurity in Washington State by area. This is a report from a recently conducted study that was jointly launched by University of Washington and Washington State. Pay attention, you'll never see those two logos together again, Washington and Washington State. We're very happy with the collaboration, which was indeed statewide. So what we are going to be talking about is the social and economic impact of COVID-19. First of all, multiple components of Washington State food and health systems continue to be disrupted. Food production, processing, and retail are under severe stress, and some industry sectors may actually not recover for a long time, or we don't know that, maybe ever. There has been unprecedented demand for unemployment benefits, for food assistance. There's a great deal of concern about health equity. Food prices have risen, and this is of concern to nutrition professionals everywhere. Diet quality is impacted, diet quality has worsened, and there will be consequences in the long term on health. So this survey that we run during the summer from June to July was to assess the long-term impact of COVID, assess economic disruptions, especially among frontline workers in the restaurant, hospitality, social services, and healthcare. They are the ones who continued working and were very likely impacted the most. This was a survey of economic issues. So we wanted to look at wages, incomes, spending, and diet quality by employment type and by geographic area. And then we did want to address economic health equity issues as they influence food security. And here we were concerned about the impact on persons of color and groups of lower education and income. And then referring back to some of our earlier work, we wanted to map everything. Politicians and policymakers use maps because this tells them where the problem is, and it also shows them on a map where to divert scarce resources. So this was a study that was funded by the UW Population Health Initiative Rapid Response Grant, with some matching from the School of Public Health and from the Department of Epidemiology. This is the overview. We launched this study online. This was a Red Cup survey. It went live June 18th to July 31st. English and Spanish versions were available. With the help of some of our stakeholders, we got completed responses from 2,600 Washington State residents, and every county was represented, with the exception of one. Most of the response was from King, Pierce, and Snohomish counties, shown here in darker colors on the right. The sample was mostly female, 81%, partnered, 60%, and with children. And 30% had incomes below $35,000 per year. Remember that the federal poverty level for a family of four is in the order of $24,000 per year. And then all responses were geocoded by zip code. So we had some way of doing a map of food insecurity prevalence by geographic area, depending, of course, on sample size. So I will just run very quickly through the key findings, but I will be discussing them in great detail, especially when it comes to food insecurity and health equity issues. So on average, statewide, food insecurity was experienced by 30% of the households, and of those, 59%, 2 in 3 had children. 1/3 of the households was seeking food assistance, and there were some issues about SNAP and WIC because online access was still difficult and not everybody was using all the benefits to the full that they were entitled to. 40% said their diet had gotten worse. Many reported greater consumption of cheap packaged foods, rice, beans, packaged foods, eggs, but less meat, fish, and in some cases, fresh produce. There were sporadic food shortages, and many respondents mentioned rising food costs as a barrier to adopting healthier diets. And then we also probed for unemployment benefits, the impact of COVID on the workplace, stimulus checks, and other economic consequences. As you will see later on, the only positive component or the only positive aspect of what is going on was the time to prepare and enjoy meals at home, which was, under the circumstances, a good thing, but it did not really overcome the other devastating consequences of what we're experiencing right now and continue to experience. Now, this is interesting. In our sample, we had many essential workers. So the employment rate was 67% before COVID. And out of those people, 54% were viewed as essential workers, which means they continued to work no matter what. Notice that the essential workers were in community and social services, that's the pie chart to the left, in healthcare, and in food-based services. The non-essential workers were business, information technology, finance, education, that would be us, and consumer-facing industries. Notice that there is a different distribution here for the frontline essential workers and those not deemed essential by the state or their employers. So we were very concerned about the impact on people who needed to continue to work, take transportation, show up for the job, show up at the food store. How were they managing and what support systems were available to them? Now, this slide was, I thought, particularly devastating because what we show here is the completely unequal distribution of food insecurity by social demographics. Remember, I told you that the overall food insecurity prevalence was 30% statewide, but see how it's spread by income groups. We have a variation here from 3% to 58%. Look at the education, from 12% to 44%. Ethnicity, persons of color, and then marital status, single or divorced persons. So what is happening here is pretty much conclusion that food insecurity was unevenly distributed and was most prevalent among single female-headed household with children, low education, low income, and persons of color. These figures really tell you the socio-demographic profile of food insecurity, which you wouldn't get if you were doing simply a statewide prevalence. So the 30% statewide conceals a lot of underlying alarming rates of food insecurity among lower income groups. Now, this was not really a surprise to us. What we have now done is produce a map of food insecurity prevalence by King County zip codes. And notice how the map distributes itself. The high insecurity areas are going to be Renton, south of downtown, Kenton, Auburn, and then up in North Seattle, up in North Aurora. Whereas areas such as Mercer Island, Magnolia, and so on are relatively less affected. Again, this is a function of incomes, socioeconomic status, and the neighborhood that you live in. Those maps were very reminiscent of maps that we had produced previously as part of the Seattle obesity study, which had been running for a long time and was funded by the National Institutes of Health. So the mapping experience we had allowed us to focus on COVID and health equity by geographic area. So there is a lot of work on deprivation indices. I'm showing you a map for Seattle King County of the SING deprivation index, which essentially takes census data at the census tract level. So the deprivation index is composed of poverty, income disparities, single parents, home values, mortgages, crowding, and then of course, education, employment, and other aspects of poverty or wealth. Notice that this map of deprivation index is kind of reminiscent of our map of food insecurity by area. Our area was at the zip code level. This is a more detailed map at the census tract level. One thing about census tract level data is they give you social demographics, but they do not really give you any health consequences because the census does not collect data on health. You have got to get health data someplace else on your own and then go back and connect it to local disparities in economic status. And as part of the Seattle obesity study, we had done exactly that. These are data on health outcomes, which pretty much track the deprivation index for Seattle King County. These data came from group health. Those are data for close to 60,000 insured adults at the census tract level. And these data are for obesity on the left and diabetes on the right. Again, notice that these are pretty much the same maps as before. I'm including them here because a lot of the literature now says that the distribution of COVID is unequal across groups by income, poverty, and race, ethnicity. In fact, persons with obesity, diabetes, hypertension, and other health conditions are most likely to be affected. So in fact, as you will see in a while, our maps of COVID risk are very similar to these maps. So moving on, these kind of maps tell us a lot. The way that we do those maps and the way that we are able to model at a very fine level of geographic aggregation is because we use property values as the main index of wealth. We get data from King County Tax Assessor. Take a look at the map on the left. It shows you the high income areas with high property values. You know where they are if you live in Seattle, or even if you do not, you can figure it out. Areas around the lake, the waterfront are more expensive. So see here, we're looking at Mercer Island, Hunts Point, Medina, Madison Park, and so on. Those are high income areas as compared to areas by the freeway, areas down in South County. Those are lower income areas with low property values. And what we do in our research, we do a sampling grid, computer moves down the map, and every 30 meters, we create a smooth map of residential property values in Seattle, which we use as a continuous index of poverty or wealth. So in fact, our maps absolutely track the Singh index, except they do not have any geographic boundaries. The Singh index is at the level of the census tract. The map I showed you before was at the level of zip codes. And here we have no geographic boundaries. We're able to track health and wealth and poverty across the Seattle space. We have used this technique to map food consumption patterns. On the left, you see geographic modeling of consumption of carbonated sugary soda. Notice where frequency is highest. It is the lower income areas away from the waterfront. And when we look in the middle panel, consumption of fresh salads, people who consume fresh salads are likely to be living in more expensive areas, higher income, higher education, and higher neighborhood socioeconomic status. The map on the far right is diet quality. Green is better than red. Green diet quality means high scores on the healthy eating index. The HEI is a federal measure of diet quality, and the HEI essentially measures compliance with dietary guidelines for Americans. So notice here that what you eat depends on where you live, your diet quality depends on where you live, and your diet quality also depends on your household purchasing power, which is now compromised by COVID. And so here we now have obesity map in Seattle, King County by census block. Again, notice areas of high obesity in dark brown, areas in yellow are lower rates of obesity, and the map on the right is the previous map I showed you. Same data, not modeled from group health, showing pretty much the same distribution of obesity and other health disparities by geographic area in Seattle, King County. The point I'm trying to make is that this pretty much is the same map. We have now mapped, based on the WAFood survey, risk for COVID-19, and we're looking at the same map. Essentially, the same areas are popping up, and this map is based on obesity and comorbidities, and we're able to predict COVID risk by geographic area. Not everyone is able to do that. These are very detailed maps by neighborhood, which we hope will be useful to policymakers and other officials, for example, the mayor of Seattle or the executive of King County. We're making those maps available to the state of Washington to target interventions and to target types of assistance that can be deployed at this time. Let me now move to nutrition-related issues. And the first point I want to make is that diet quality was affected. We did ask our respondents, what is it that they ate more of? What is it that they ate less of? And were there any specific barriers in food access? So we found that more respondents were reporting diets that were either fair or poor. Our respondents were buying more eggs and rice and beans and snacks and bread, and they were consuming less fresh meat, fish, citrus, and dairy. This could have been due to cost, but also to sporadic food shortages, and also to the fact that our supply of agricultural produce is now affected because some of the farm workers have now contracted the virus as well. So notice the pattern of food purchases right now. And notice here also that cooking at home has gone up. There was a run on flour and baking goods and other foods. People, of course, are cooking more at home, but patterns are changing, perhaps for a long time. There were concerns about food access. Most of our respondents were confident that they would be able to access the foods they needed. Remember, this was June and July of this year. We are not sure what is happening right now. Notice that there was a run on flour and baking supplies, and there were concerns about reduced access to meat and chicken and cheese and eggs and so on. But interestingly enough, there were no concerns about access to chocolate or candy or boxed or bagged snacks and packaged baked goods and sugary drinks. And we're interpreting that as evidence that in times of budget restrictions, stress, people are turning towards familiar, energy-dense foods, which are shelf-stable, low cost, but those foods may have minimal nutritional value. And therefore, it is my prediction, it's an unfortunate prediction, but there you are, is that this type of food pattern, prolonged over a period of time, may have very profound effects on childhood obesity and the continuing health of families. It will take a long time to get away from that, given that the food patterns are visibly changed. The barriers mentioned by our respondents, well, first of all, food cost. Second, people do not feel safe in a supermarket. This was before masks were required, now they are. There were issues about stockpiling foods, buying a lot of food at one time, unsafe public transport, concerns about fresh food, and hence the push towards packaged foods, and other issues, including access. We, of course, also probed food assistance, because food assistance is now playing a vital role. We found that the enrollment in SNAP that's food stamps, and WIC did not go up. This could be perhaps due to the necessary now electronic paperwork, barriers to accessing the benefits online, unfamiliarity with the fact that some of the benefits can be accessed online. But on the other hand, there was much greater use of summer school meals. This was the summer, city vouchers and cards, food boxes and food banks and food pantries. Stimulus checks were actually received by 77% of our sample. Not all our respondents were fully using SNAP benefits. Many have not used SNAP online or did not know about it, and some were unable to do so. And then there were issues about WIC foods, again, remote access, remote enrollment, limited food choices, and the lack of WIC online use. And then there were issues about worrying whether or not our respondents qualified, worries about travel, insufficient benefits, no online certification. All those issues were actually transmitted by us to the various agencies because we hope that our work will help the state of Washington deploy the benefits to their best advantage. Food banks were very heavily used. And again, here we looked at potential barriers to the full use of food banks in terms of location, hours to visit, foods that were being available, waiting times, and so on. Food banks have now gone back away from the open store model, more towards food bags and food packages for distribution, or in some cases for delivery. They're playing a vital role right now, as they always have been. So workplace response was variable. A lot of our respondents were working from home. Some had reduced work hours. For 11%, there were temporary firm closures, and about 7% experiences permanent closures and permanent layoffs. And unemployment was sought by 28%, but 40% of those had difficulties in getting unemployment benefits. Positive responses, well, there were very few. One was more free time to enjoy preparing meals. This is a kind of double-edged sword, I think, because with the frontline workers, they still need to go to work. Not everybody is able to stay at home and be free. In fact, many of us who are working at home are working more frequently and for longer hours than before. But notice that people also mentioned community support, local grocers and restaurants, local food assistance, connecting with local farmers. And the one negative thing, we kind of laughed at that, don't tell anybody, was the community leaders. So there was a bit of a reduced confidence in what the government can do for you. We are now planning the WAFood survey number 2 because the situation is actually getting worse. We're hoping naively back in June, July, that this would be over by September. Clearly, it is not over. We're now facing the second wave and unemployment benefits are running out. The second stimulus package is or has been debated. We don't know what tomorrow will bring. So this technique and this methodology allows us to resample the Washington state residents. We insist on geocoding because we want to have granular data by county and even by zip code. We're looking forward to a larger sample and more support from the state of Washington. We have already had substantial impact on the work of our various supporters and stakeholders. We have shared the work with Northwest Harvest. We have shared the work with Washington State Extension and the National Food Access and COVID Research Team, coordinated by Centers for Disease Control. Our findings were in fact presented to the Seattle Mayor and will help to inform the city response And then my colleague Jen Otten has received a number of related grants on the impact and feasibility of WIC from Robert Wood Johnson Foundation, and another grant from the UW Population Health Initiative to explore food access and food insecurity among American Indian Alaska Native tribes in Washington State. And we're doing this in collaboration with the Northwest Tribal Epidemiology Center and with Washington State. That survey will be co-developed with tribal leaders and will be launched by the Northwest Tribal Epidemiology Center among tribes in state of Washington, with possible extension to other states. We're very excited by that because the issue of tribal food access and the issues of tribal food sovereignty at this very difficult time have not really been explored. This is our research team, which, as you see here, combines faculty and staff from the Center for Public Health Nutrition, Washington State, Tacoma Community College, and others. We're very pleased also to have had support from many stakeholders, including the Public Health Initiative, the School of Public Health, the EPI Department, but also Washington State Department of Health, Agriculture, and a number of NGOs and food banks, food pantries, and charitable organizations and community organizations. We could not have done this without them. So I'll finish here and thank you.
Adam, thank you so much. If there were a room full of 250 students with us, we would all be clapping and sharing our gratitude for that excellent presentation. Thank you so much for sharing this incredibly timely research. And as you said, these devastating results. It is two things, I found it, I was so struck by how the food insecurity maps of COVID actually map to all those other data points that you've been collecting, and just the intersection of food insecurity and other health metrics and property values and the deprivation index. I mean, it's just so striking. And it seems to be that we are dealing with deeply embedded problems. And I wonder if out of this research and out of your vast experience of doing this related research, you have recommendations for changing the map, if you might have recommendations that could create a new reality.
Yeah, we were actually a bit shocked because we had been hearing from CDC and from everywhere else that the virus does not discriminate. It can affect anybody, anytime. Well, you know what? The virus does discriminate, and the virus is settling among lower income groups and communities of color, and we know where they live. So our work pretty much allows us to pinpoint the need for extra resources and extra interventions in given areas, because this is where our work takes a step away from the common approach to this, because we do insist on the socioeconomic determinants, health equity, and inequality against neighborhoods. So we can't do much about the property values on the waterfront, but we can certainly make sure that such resources as they are get deployed to the right areas. Some people are in much greater need. We know who they are. We know where they live. We know what neighborhoods they are in. We know which food banks they go to, and we can track all those things. And I think that component is very valuable to policymakers. About property values on the waterfront, we can't do much about that. We actually want to work with Zillow a bit, but that's another story. So we can't do much about that, but we can do a lot about all the other things about food access, yes.
Thank you. I hope your message is received loud and clear. This is clearly a dire problem, and as you said so articulately, that it is a growing problem. We are not anywhere near the end of the COVID road, for example, and I, for one, am very glad to hear that you are planning on a WA Food Survey too. And I think it's just critical, and that you continue to collect these data so that we better understand the problem and better understand how to distribute the resources. So thank you for sharing that. I'm going to just switch gears from the last question. and share with you that the students in this class who come from, as you know, since you developed the survey or the seminar to start, you know that students are coming from across the university, from every program across the university. And they're all drawn to this food system seminar, you know, to learn about these contemporary and pressing issues. Their final assignment this quarter will be to craft a food system vision that centers resilience and equity. And not to put you on the spot, but I wonder if you might have any words to share with us about your own vision for what a food system that does center resilience and equity might look like. And maybe there's a temporal aspect to that because we're really still in the middle of this pandemic, you know, in the shorter, the medium term, and the long term.
Well, there is a great deal of work to be done. One interesting component is the alternative food systems. So what's been happening is this. Many of the producers, farm producers who are selling to restaurants and to industries are now unable to do that. They are reshaping, retargeting some of their supply at supermarkets. But in some cases, they are trying to sell directly to the consumer. So that would be an interesting way of seeing whether or not this is the time to explore the alternative food systems which are always there with community-supported agriculture, direct farm to school or farm to fork programs, and some way to make sure that the consumers can access the healthy food. Because you have blocks at the level of production in some cases, in Yakima County and elsewhere in terms of agricultural production, but you also have blocks in distribution and retail. So what can we do here to alternative food systems to make sure that the food continues to be flowing to the consumer? Because this is what keeps us going. And I think that the food service workers and the food workers, both in agricultural and distribution sectors, are really out on the front lines for us. So there are two things. One, people say the food system is broken. Well, it isn't exactly broken. It's still keeping us alive through sacrifice of many people. But at the same time, we need to look at alternative ways of producing food because we may be stuck with the situation forever. Otherwise, I think the tendency will be to go towards the boxed snacks and chocolate and notice the amount of advertising for Halloween. We're going to be awash in chocolate and candy advertising. And this may not be the best thing under the circumstances. We need to make sure that the food supply continues to flow and what are the other ways of expanding it.
Thank you. Thank you. I agree. And I think there's probably no way to stop the crush of Halloween advertising for candy, but at least to have some context for how to understand it over time. Yeah. Well, Adam, I just want to thank you again for this this survey, but also a deep dive into the results of this first survey. And thank you for your time and expertise in sharing this with our food system seminar. I'll give you one more round of applause on behalf of all the students. And students, please remember that you do have a reflection due this Thursday. We look forward to learning more about what you learned from this seminar and what questions still remain for you. Thank you so much.
Thank you, Jana.